I'm here with Suzanne Lonngren, who is a patient of Dr. Lewis and who recently had the anterior hip surgery. And Suzanne, I understand you're a nurse at Good Sam, and you've taken a little break now while you're healing from this procedure. I just wanted to ask you about, you had the traditional surgery first, and then you had the anterior hip surgery on your other hip. What was the difference?
The most remarkable was pain level. Much, much, much less pain. That's not to say no pain and no discomfort. This is major surgery. They're going all the way down and into the bone. But there is much less damage to tissue. There are 3 muscle groups that they tear apart on the traditional side that they don't on the anterior approach. And I think that's what's significant.
So less hospital time for you?
5 days as opposed to 2 days.
Wow, what a difference. And what about physical therapy, less physical therapy probably?
There was a full course of physical therapy for my right hip. I believe it was some 6 weeks, 3 days a week. My left hip, Dr. Lewis didn't think I really needed any, that walking is sufficient.
What makes Dr. Lewis a good surgeon for this particular kind of condition?
Well, his talent, but his attention to detail. He doesn't cut corners. He does what needs to be done, that he can be assured the job is absolutely perfect. And if that means take an extra x-ray, take a little extra time and measure more, stand back and look at it, think, he does it. He does what it needs to be done so that what implants he uses, what procedures, what cutting he does is absolutely what is right for you. I get the feeling with Dr. Lewis that he's like Michelangelo, and each patient is going to be his masterpiece. I've never seen him be bored. I've never seen him in 10 years rush through anything, be pressured by time. He gets in the zone, and he does a phenomenal job.
And now as a nurse, you've seen him do this procedure many times, and now you're one that, now you're a patient. What's that like? And
that too is night and day.
And how has it made a difference in your life, this surgery?
Oh, as I can hop in and out of a car without thinking about it. You know, I get up in the morning. I can, get up in the morning and do what I need to do without, am I going to get there in time, if you know what I mean. There's no, oh, this hurts, that hurts. I can run up and down stairs, which I haven't done in 10 years. And I'm naturally an active person, so this has just been 2 or 3 weeks and I have not walked without a limp in 10 years from one side to the other. And to be able to walk like this, I'm looking forward to wearing high heels. I told them all at work, I'm going to get the high heels on and swish in front of y'all because they used to make so much fun of me. They'd call me Hashimoto and all kinds of names. I'd say, just you wait.
Well, you're a good role model for other people that are having it done. And the difference, again, in the surgeries is as it compared to the traditional surgery, the anterior surgery is done, the anterior approach is done from the front.
Right.
As opposed to the side or back.
The incision is on the side of your rear end, posterior. And it's right down the front, anterior.
And affecting fewer muscles and...
Right. They're not torn apart.
Thank you so much. You can learn more about this surgery, the anterior approach to hip surgery, by logging on to Dr. Lewis's website at www.anterior-hip-surgery.com. And there's also a downloadable brochure for anyone interested in learning more about the procedure. Thanks so much, Suzanne.
Oh, you're so welcome. It's been a pleasure.
Thank you.